Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading healthcare IT resources, and I'm happy to host the CMO of Samsung today, Dr. Rhew. Before we get to his full intro, just a few logistics for those watching live. We'll talk for about 30 to 40 minutes, depending on how the conversation goes. And then after that, we'll open it up for questions from the audience. If you want to hop on, share your insights, ask Dr. Rhew questions, ask me questions. The second half, we call that the after party. We welcome you to hop on and ask any questions that you'd like. Also, if you're watching live, if you like the person or if you like what they're saying, give them props by clicking on their face. It's always fun to see when people respond and react that way. Also, on the left-hand side is the option to tweet or post it to Facebook. If you do that, we'd much appreciate you sharing this with others so we can get a larger and larger audience, especially for the after party. So we have lots of people joining in and sharing their perspectives. So, and one other thing, if you have any other questions and don't want to hop on camera, or even during our interview for the first half, you can put /Q space and then your question, and that will queue it up for us. If we have time, we'll try to answer it during the conversation if it fits into the flow. If it doesn't, we'll definitely answer it afterwards in the after party. All right, enough with the logistics. I'm excited to welcome Dr. David Rhew, Samsung's Chief Medical Officer. Welcome, David.
I'm glad to be here. Thank you.
Great. So to start us off, tell us a little bit about yourself.
Okay, sure. I'm a physician. I've been in healthcare IT for the past close to 20 years, and also a health services researcher. And you probably know what a physician is. Probably know what a technologist is, but you may not be as familiar with the health services researcher. And all that really means is I spend a lot of my time thinking about how can we improve patient outcomes? How can we improve quality of care, access to care, efficiency of care, and patient satisfaction? Nice.
Well, I'm amazed you said 20 years. You look like you're 20 years old, so it's probably good that we started with that because you're probably a little like me. I look younger than I am, and I am pretty young. And so 20 years, that's quite a depth of experience, and you don't show it. So credit you.
Thank you. It's the oil of Olay.
Nice. Well, before we talk about HIMSS specifically, which I think we want to talk about what are we going to see at HIMSS, I thought it might be good to start that, like most of us know Samsung as more of a consumer-focused company. So tell us, why is Samsung interested in an event like HIMSS that is very much more focused on the enterprise healthcare and enterprise IT?
Great question. So as you and your listeners know, healthcare is moving from the hospital to the home. Moving from sick care to wellness and prevention. And it's moving towards a model where the patient is the center of the care model. And central to all of this is the need for us to find ways to better engage patients and consumers in their healthcare. So at Samsung, we have a very unique opportunity because much of the technologies that we have today are used by clinicians or by patients every day as part of their normal workflow. Mm-hmm. And one of the things that we have done is each of our technologies have sensors embedded that allow us to be able to capture data, transmit it to other individuals. These could be family, friends, healthcare providers. And what we find is that we can potentially impact care by allowing us to be more proactive in understanding if an individual is heading in the wrong direction. How can we better recognize that? How can we better support them? So we're pretty excited. We think that we have some really great opportunities to leverage these technologies to improve patient care and also to improve the workforce efficiency on provider side.
It really is kind of a unique position. There's only a few companies that could say we just created such a great product. They adopted us. And so we're de facto a healthcare IT company just because healthcare chose our products because they're that good, right? I mean, because you're right. I mean, how many Samsung phones are in there? How many Samsung printers are in healthcare? A lot.
That's right. It's amazing when you think about it. It's not just the phone or the tablet, but it's really the whole ecosystem of all the different types of devices that we can use, not just on the go, but also in the home. I think the whole Internet of Things, the smart home, is becoming a very important part of what we're looking at in terms of ways that we can make a more seamless experience, almost invisible for individuals. So we can then apply the principles that we know that work in the hospital, whereby workflow and lifestyle are very important in terms of gaining engagement for clinicians. We can follow that same principle for patients and consumers.
That's great. So let's talk about some specific examples, and maybe start with the concept of the connected hospital. What do you think you will find at HIMSS around the connected hospital, and what's Samsung's role in that?
So I think in terms of the connected hospital, there's many different types of advancements that we can see, one of which is the advancements that we see in terms of sensors. And these sensors are being used in the hospital to rapidly identify if a condition is worsening, which would then require immediate medical attention. And oftentimes these sensors are in the form of patches or wearables. But what we're also seeing is a tremendous amount of interest in whether or not mobile devices could be potentially used. And these mobile devices and displays allow us the opportunity to understand whether or not we can streamline the workforce efficiency, the experience that patients have in terms of being able to visualize the information that's presented to them. So I think the overall arching theme is that digital technologies are enabling the seamless data capture, and it's the complex analysis and a lot of the different display back to both the patient and the healthcare provider.
Nice. I know at CES I saw, if I remember right, the announcement was Early Sense was the bed sensor.
Yes. Or Sleep Sense.
Bed sensor together with Samsung, which is nice. It has a home application, but also has a hospital application as well. So I think that's a good example of those types of sensors that you're talking about, right?
Right. And the Sleep Sense is a great example because what we realized is that most people were originally thinking this would just help an individual better track and monitor their sleep. But in conjunction with that, we can determine multiple different related aspects. People who are waking up in the middle of the night frequently probably have some issues, one of which may be there's a urinary tract infection. They could certainly present an increased risk for falls since it's in the middle of the night. So it gives us some new insights in terms of how one's doing. And the other thing we also realize is that sleep is a critical part of one's ability to stay refreshed, to address the ongoing challenges during the day. And if you don't have good sleep, you don't have a good day. So we all know that sleep is important.
No, absolutely. I think it's fascinating. And it's perfect for communication in a hospital because they're in the bed and they're a captive audience, whereas at home they may or may not be in the bed the same way.
That's right.
So that's great. The other vision I've seen for the connected hospital is the idea of like every surface could potentially be a touch screen, right? That's kind of big picture thinking, right? Like imagine the walls were touch screens, and imagine the patient room was, and the check-in when you get there's a wall and it has the information you need. And I don't, we're not there yet, but I think we're going to see similar things to that, with massive LCD screens, right?
Absolutely. And we're thinking of it in terms of two different users. There's the family, the friends during the wayfinding, trying to find your way to the room, the patient in the room seeing a big, what we'll call it, a dashboard of their things that they need to see. In fact, that's something that we are working with several hospitals to deploy this patient dashboard in the room that allows them to not only interact with their or visualize what they need to do throughout the day, but also potentially interact with their healthcare providers. And then on the flip side, you've got the nurses and the other clinicians that would love to be able to collaborate around patients. We see this all the time with rounds, whether it's nursing rounds, physician rounds. So the digital whiteboard, so to speak, is an excellent vehicle that allows us to be able to better collaborate.
Excellent. Yeah, a number of areas we're going to see it. I mean, the other area, I guess, is the phone itself, right? I mean, more and more everyone's carrying a phone around, whether it's a personal one or a work one. What are you seeing the balance there as far as people using phones in the hospital? Are they doing more enterprise? Are they doing more BYOD? Or what's the approach?
Oh, I mean, absolutely. This is one of the big challenges within every organization. This go even beyond healthcare or hospitals. This is
for sure.
Enterprise security and the ability for you to have better control and management of the devices versus the convenience and flexibility of having your own. And I think one of the challenges is that with BYOD, in many cases, you marry or you intermingle your personal with your business, and in cases where they would need to maybe do a wipe, or where you've lost your phone temporarily, that could be quite problematic if they wipe out all your information. So
the pictures of your children. I can
no
hear
more
them both already.
So I think the challenge is essentially trying to figure out ways that you can separate those two out, be able to also apply some of the nice things that we know that the corporate liable devices can provide, which is the security, the kiosk mode, elements around that. So I think that today this is an area that Samsung's been spending a lot of time thinking about. I'm not sure how familiar you are with Knox, but it's our security platform. It allows one to separate literally personal from business. It was ranked one of the top most secure enterprise platforms for the device. So I think we are spending a lot of time thinking about this in terms of how this could be deployed in multiple enterprise settings.
Yeah, I actually wrote an article leading up to this conversation a little bit about Knox, and the premise is that before it was really hard to secure a mobile device because it was so new and it was such a challenging environment and nobody knew how to do it right. The tool sets weren't there, the software wasn't there. But I think what are we, 5 years after really the smartphone revolution. And that's now their software is there. I mean, you have Samsung Knox. There's lots of solutions. If they're not securing the smartphone, if they're not doing encryption, they're at huge risk. It's not like they can say, "Oh, well, it was really hard. I didn't know how to do it." Well, now there are best practices, right?
Absolutely, yes. And I'll tell you that with these phones getting more sophisticated and allowing us to have newer sensors, that data is going to get captured and stored on the phone before it gets sent to the cloud. So we have to find ways to secure and lock that down as well.
No doubt. I think that's going to be a big discussion at HIMSS, right? Especially after the ransomware incident at that hospital. Any other comments or feedback, suggestions you have for people that are looking at how do they address security of their mobile devices?
Yeah, well, on the same topic that we were talking about, I think there was a recent report that talked about healthcare apps, and it looked at the security around them, and they found that the majority of these apps had some deficiency, some holes that allowed individuals to be able to access information that they probably shouldn't be. And so this gives sort of a greater emphasis for us to start thinking about how we can secure this information on the device itself and in mechanisms that we haven't done in the past. Healthcare applications are becoming much more sophisticated. They're involving patient data, they're involving communications, chats with your provider, and I think we have to start recognizing that the old model of the phone being a pure consumer device, there is clearly now becoming a role for some level of security around that device.
Yeah, absolutely. So let's shift gears. I mean, we've talked about the hospital and some of the technologies we'll likely see at HIMSS in the hospital. But I think the other one that's going to be huge at HIMSS is the home. And actually, Dr. Jimmy, we should rename him Dr. Jimmy, James Legion.
Is he on the list here?
Well, we always call him Jimmy Vanagan, so that's what we call him. But I should treat him with respect and say Dr. Anyways. Regardless, he asked the question, he said, how can we engage Medicare patients at home via telemedicine when the patient's home is not even considered an originator site, thus no reimbursement? So, I mean, he's really hitting on the challenge of we want to provide care to the home. I know Jimmy, he lives up there in the cold tundra up there in the north, and he wants to serve them. And sometimes they can't get to the office because they're snowed in or because whatever reasons, right? And he wants to be able to serve them, right? But there's no reimbursement. Any thoughts on trends you've seen there?
Absolutely. So that is the number one issue right now from the provider side, the reimbursement issues and the payment models. So the majority of right now, the payment models are still fee for service. We are seeing definitely a push towards more at-risk models, shared savings. I think the point where there's a tipping point where organizations start realizing that they need to become much more invested in these technologies, because it benefits the overall reimbursement piece, that's when we'll start seeing a change on the physician side. Stepwise, baby steps we need the legislation to pass where specific episodes are reimbursed for telemedicine, but you're not going to see the major shift until the reimbursement model is completely changed. And there was a very telling sign when the Health and Human Services Secretary Burwell reported in early 2015 that by 2018, about 50% of all fee-for-service payments will be based on some type of shared savings or bundled payment, capitated payment model. And we're also seeing a dramatic shift in terms of all payments towards where there's an element of quality that needs to be incorporated into it. So, hopefully we'll start seeing some changes that will allow us to be able to address this question today. I'd say a large part of what needs to be done even before then is building the infrastructure and even the changes in the way that we deliver care. So much of care today is delivered by the physician being sort of that central point. And if it turns out that everything is dependent on the physician, then these models still won't work. So we have to think about, different types of ways that we can, what we'll say, maximize individuals to practice at the top of their license, to be able to leverage family and friends and other individuals, and to really engage patients so that they're empowered to be able to know what needs to be done. That's where we're going to start seeing some more dramatic changes in the way that we see digital and telemedicine.
Excellent. I think there's a couple other concerns that, along with that Medicare stat that you did, there was a consortium of insurance companies that came out and said, I think it was 75% by 2020 or something like that. So similar trend, right? And the other one I think that's interesting is the high deductible plans. As I start having a high deductible plan, my copay might cost as much as a telemedicine visit, right? And so, it was at UPMC has $35 visits, telemedicine. Well, it's like, that's pretty close to my copay. So, I'll just pay for it myself and just, not deal with insurance at all. It doesn't hit, my insurance, and that might be better. So definitely.
It's a lot more convenient. You don't have to fight for parking. You don't have to waste your whole day. Yeah, no, there's a lot of advantages.
Yeah, and I've argued telemedicine might not be revolutionary from the doctor perspective, because the doctor experience is still the same. They have to document the same amount. They have to spend the same amount of time with you. But from a patient perspective, it is revolutionary. And I think that's where the disconnect evolves and the challenge of it, right?
That's right.
So, we need the patient to pay for it, or the insurance company, or whoever else. So.
Right.
Are there other Internet of Things type stuff in the home that you think we'll see at HIMSS? And what do you see that's interesting? Since obviously, I think a lot of these Internet of Things want to connect to your Samsung phones and your Samsung tablets and those types of devices. What do you see happening in the home?
Well, I think one thing we're definitely seeing is that individuals like to have some kind of a hub for them to be able to manage all the different things around them. This hub could be either a stationary hub, sort of like a device that sits in the middle of the room, or in many cases, it's a mobile hub. It's a tablet or a phone or even a wearable. And when you start thinking about how you can then leverage the fact that you've got a wearable or you've got some kind of a mobile device that allows you to be able to move and then access and turn on and turn off and do a variety of things in the room, then you've got a lot more flexibility and more convenience that allows you to be able to do things that I don't think in the past we've recognized were important. Today, a lot of the IoT smart home is convenience, adding elements that make your life a little easier. What we're finding is that for most people, those are nice to haves, but in certain populations, these can be quite meaningful and in fact would be highly relevant. So if we were to take a look at, let's say, an individual with severe arthritis, a senior who has poor mobility, someone with poor vision, the ability to be able to control devices through something that you can look at on your phone or on your tablet, or even with arm gestures, then becomes much more meaningful and something that they will want to use. And that seems to be a really nice opportunity for us to then realize that if they're using a device that seems to be highly engaging, provides value, can you then use that device as a means to provide communications with them, be able to capture information, basically enable a greater opportunity for collaboration with that patient. And I think that's where we're starting to see the great opportunities.
Interesting. I saw an interesting example at CES where we'd seen the evolution in thermometers in your home, right? Everyone has a thermometer. They want to control the thermostat. And then we saw Nest, which Google bought, right? Which is on there, and it's a smart thermometer. And so then at CES, I saw the next evolution of that. They were literally putting a tablet, like a Samsung tablet, on the wall, and it did what Nest did, but it did so much more. And I started thinking about it. It's like, okay, well, I could see people buying that because they want to control their home and they want the convenience, like you said, of having a cool home or a hot home and saving energy, all of those reasons that you buy a Nest or something. But then I started thinking, I was like, wow, now imagine you have all these health apps there, right? And you're in your home and you have this app there. Now just apply something like Alexa or Siri, right? Amazon's Alexa, with the Amazon Echo or Siri to that. Now you just created a smart thing. I mean, one of the apps on Alexa is you say, give me my 7-minute exercise.
Yeah.
Perfect, right? And you're always connected because it's sitting there on the wall waiting for you to talk your commands, right?
That's right. Yeah, convenience is very important, and tying all these multiple elements to it. I think when I have been looking at a variety of different these platforms and hubs, we oftentimes think of devices as sort of only providing one function. But in many cases, what provides value is when you can do multi-functions on a device. I mean, really, that's the genesis of the smartphone.
Yeah.
Think about it. It's the fact that you can do internet, you can do email, you can do texting, you can do a variety of other things. And that ends up becoming your centerpiece for how you manage your world. And in the home, we have not yet today established those hubs. But I'm starting to see much more that those hubs could either be stationary or mobile. And once you've got that in place, it creates a very unique opportunity.
That's such a great concept, though, that it needs to do more than health. That's why we put the Fitbit back in the drawer, but our smartphone still sits in our pocket, right?
That's right. Yeah. I mean, if it's health in itself is not as motivating as maybe being able to communicate with the loved one. Being able to access information that you cannot normally access, to be able to learn and explore and feel and have fun. These are all the things that keep people motivated. So when you're able to incorporate all of that into the device, then next thing you know, you've got something that people will use irrespective of the health. And then the health just becomes a natural part of what they do anyways.
Yeah, and it seems so natural. I mean, that's when I saw that thermometer that was a tablet. I was like, that's just a natural, opportunity. Like the technology is already there. You can build it to do whatever you want. So I think someone, to me, I saw that vision. I said, that's what I see happening with like you said, the hub of the home. But there's a lot of connecting that needs to happen still, I think.
Absolutely.
So let's shift gears to some wearable technologies. What wearable health technologies are going to help us? And I wrote an article about the Fitbit, and I said the problem with the Fitbit is it's not clinically relevant yet.
That's right.
So, I guess my question to you, will these wearable technologies really improve health?
Well, I think that's the question that we're all trying to figure out. And I really reflect on kind of the approach that we've taken, which is we've given a technology to an audience and expect them to all of a sudden be able to use it to capture data and improve health themselves. Appeals to the healthy, the fitness oriented individuals, the ones who are very data motivated, and yet at the same time, the population we want to target are the folks who are probably least likely to use it, have chronic disease, and ultimately would not continue using it even beyond even a day or so. So I think there's a disconnect in terms of our approach. And so this is where this gets back to our prior discussion around, can you make the wearable something that is much more relevant to their lifestyle first, provides value, something that can be done as a means to provide entertainment, a variety of things. So I think we need to start thinking about how wearables can incorporate music. Music is an important part. How wearables need to incorporate ability to control your room, There's so many other elements that we haven't yet fully understood how wearables can play. But then once those are used and you've got engagement, then you've got an ability to be able to capture discrete elements and send that to healthcare providers and your family and friends. I think the other thing that we see is it's just in terms of the amount of raw data that's captured, it's unfiltered, and the reality is most healthcare providers don't want to get truckloads of this information sent to them. They need it somehow filtered, and it needs to be relevant. And so this is something that at Samsung we've been thinking quite a bit about, and we've been talking to hospitals and health systems to identify what are those discrete units that would be important. And rather than sending or being able to send all of the data, let's just send the stuff that is most meaningful. And that's something that I think we haven't yet done today, but hopefully down the road we'll get to the point where we are capturing just the relevant information and we're being able to share just that.
No, and I think the other side of that is that, you talked a lot about the wearables, but I think also the sensors that are either part of those wearables or connected to those wearables, I think they're going to evolve in a dramatic way. And so, I mean, I think, 2 years from now, a year from now, we're going to say, well, we used to think that we were getting waves of data, but 2 years from now, we're going to be like, no, we weren't getting much back then. We were just getting steps and heart rate and maybe some blood pressure. But then we're going to start having, what's the status of your kidney, right? Like, I think that's where we're headed. And
right.
then your problem is even more profound, right?
Well, I think this is what we're definitely seeing today, that there are a lot of different things that the wearable can do. One, there might be sensors that could be directly embedded on the wearable that allow us to capture information. But it also could be a device that allows us to triangulate information from multiple different sources, other wearables on your body. And then from there, either on the wearable or in a cloud platform or some other mechanism, we can make sense of all this disparate data. And I think this is where the partnerships with other types of device makers, not just external body patch and clothing and other types of sensors, but even sensors that are embedded within one's body. We work with Medtronic, the largest medical device company in the world, and they obviously have spent a lot of time thinking about how these devices can be utilized to measure the internal components of your body. But at the same time, the user experience is something that they are very focused on, and we are really trying to marry what we can do on the end user consumer experience side with wearables and phones and a variety of other things, and capture that same data and allow us to be able to utilize that in ways that are meaningful. So I think we're going to definitely see a lot of advancements in the way that wearables are used, both in terms of newer sensors, but also in the way that we're integrating these wearables with other devices.
It's interesting. When you were talking, I thought you were going to say instead of just the external body, and then you went internal, like some devices or sensors inside the body. I thought you were going to go even outside of our body into our environment, right? And there's so many studies that talk about, well, if you live in a place that has certain conditions, of course you're going to have respiratory issues because the air quality, if you live in Beijing, China, is going to be a problem for you, right? So I mean, all of these external factors influence our health as much or more than what's happening with our body itself. So which is probably the third other element, and maybe that's takes us back full circle to that whole hub that knows our environment, it knows our body, it knows inside our body and everything to understand the health.
Absolutely, and in certain disease conditions like asthma, COPD, that the environment is probably one of the most critical factors. So, I definitely didn't want to exclude that. That is part of the overall ecosystem of different sensors.
No, absolutely, and I think the most special changes in healthcare are going to be companies that combine multiple factors, right? I mean, that it's one, you can do good with one, but you can do so much more, and it will be surprising. It will be shocking to us when people start combining multiple sensors.
That's right. Yeah, the data gets much more rich when you have multiple different data points. And if you rely only on one, you've only got one lens. But we have an ability now to capture multiple.
It's going to be a lot harder.
Points.
Well, we'll do one last question, and then anyone that's watching live is welcome to hop on and ask us some questions or add their own insights. But last question, what do you think won't be at HIMSS? Is there something, I mean, it's 1,300 vendors, 45-ish thousand people. So it's hard to think that something may not. Is there something you've seen maybe at CES or Mobile World Congress or somewhere that, really should be in healthcare, but we probably won't see it at HIMSS?
Well, I think traditionally HIMSS is a great place to launch programs, to talk about partnerships, to share what you're currently doing. But it's not necessarily the environment or the right forum to launch products. And products, I mean, like new hardware. That's where you see these other conferences, like you mentioned CES, you mentioned Mobile World Congress. That's where we start seeing a lot of the really innovative things that are launched. And you'll see more coming out. Samsung obviously has quite an interest in healthcare, so you'll see more related to healthcare coming out from Samsung. I think this is an area where we are very excited because we feel like the opportunity to marry the advancements in technologies, specifically on the hardware side with the software platforms and the existing infrastructure and the key stakeholders is something that will allow us to be able to drive towards better outcomes. And that's really the purpose of what we're trying to do. We're trying to find ways to leverage these technologies so that we can engage patients and consumers to better their health.
So do you want to leak any of those announcements? It's a few days to HIMSS. We can just share right now just a few of your closest friends, anything you want to.
I'll have to pass on that one.
I have to do my job. So, all right. Well, we're up against the clock on the formal interview side. So I want to thank our special guest, Dr. David Rhew, Samsung's Chief Medical Officer. I'm John Lynn, founder of healthcarescene.com. You can catch this recording on healthcarescene.com's network of blogs and also on our Healthcare Scene YouTube channel. So check it out. Thanks so much, Dr. Rhew.